Fever. It's a word that can send shivers down a parent's spine, a feeling we all know too well. It's that uncomfortable sensation that makes us feel weak and tired. Simply put, fever is a temporary increase in your body's temperature, usually due to an illness. It's your body's way of fighting off infections. Imagine your body as a house with a thermostat. When you get an infection, it's like someone cranked up the thermostat, making the house warmer. This is your body's natural defense mechanism. A normal body temperature hovers around 98.6 degrees Fahrenheit or 37 degrees Celsius. This is the baseline for most people. Anything significantly higher than this baseline can be considered a fever. It's a sign that your body is working hard to fight off something. While a slight increase might not be cause for alarm, a high fever can signal a more serious underlying condition. It's important to monitor and understand when to seek medical attention. Deep within our brains lies a tiny region called the hypothalamus. This remarkable area acts as our body's internal thermostat, diligently regulating our core temperature. It's a bit like the control center that ensures our body stays comfortable, like a perfectly climate-controlled room. When we're healthy, the hypothalamus keeps our temperature balanced. But when our immune system detects intruders like bacteria or viruses, it releases chemicals called pyrogens. These pyrogens travel to the hypothalamus and essentially reset the thermostat, raising our body temperature. Fever, though uncomfortable, is actually a sign that our body is working hard to fight off infection. That's right, fever is not the enemy. It's an ally in our battle against invading pathogens. Think of it as our body's natural defense mechanism kicking into high gear. The elevated temperature creates an environment that's less hospitable to harmful bacteria and viruses, hindering their ability to multiply. Simultaneously, fever helps ramp up our immune system, making it more efficient at fighting off the infection. It's like raising a microscopic army to defend our body. Section 4. Behind the scenes. How fever unfolds. Fever is a common response to infection, but have you ever wondered how it actually happens? The process of developing a fever is quite fascinating and involves a series of well-coordinated steps. When our immune cells detect an infection, they release signaling molecules known as pyrogens into the bloodstream. These pyrogens are crucial in the fever response. These pyrogens journey to the hypothalamus, which acts as our internal thermostat. They signal the hypothalamus to increase the body's temperature set point. The hypothalamus then sets off a chain reaction within the body to achieve this new temperature. Our blood vessels constrict, reducing heat loss from the skin, which helps conserve heat. We might start shivering, which generates additional heat through muscle activity. This is the body's way of producing more warmth. These physiological changes all work together to raise our body temperature to the new, higher set point. This elevated temperature helps our immune system fight off the infection more effectively. Section 5. Types of fevers. A brief overview. Fevers can be categorized based on their duration and pattern. We have the common acute fever, which typically lasts for a short period, often a few days, and often accompanies common infections like the flu or a cold. Then there's remittent fever, where the temperature fluctuates significantly throughout the day, but doesn't return to normal. And then there's chronic or persistent fever, which lasts for an extended period, often weeks or even longer. This type of fever might indicate a more serious underlying condition and requires further medical investigation. Section 6. Conclusion fever, a friend or foe? Fever in most cases is a natural and beneficial response to infection. It acts as a signal that something is amiss in our body. It's a sign that our body's defense system is actively fighting off invaders. The rise in temperature helps to create an environment less favorable for pathogens. However, like a helpful friend who can sometimes be overzealous, fever needs to be monitored. If left unchecked, it can lead to complications. While a mild fever can be managed with rest and fluids, it is important to stay hydrated and get plenty of sleep. A high fever can be dangerous, especially in young children and older adults. It can cause dehydration and other serious health issues. It's crucial to consult a healthcare professional to determine the cause of the fever and receive appropriate treatment. They can provide guidance on how to manage symptoms effectively. Remember, understanding fever empowers us to take better care of ourselves and our loved ones. By recognizing when to seek help, we can ensure a quicker recovery and prevent complications.